Everybody in the CBT class. My name is Dr. Mack. I wanted to put together this video to, basically have an interaction and go over the syllabus, go over some of the expectations for the class. If anybody, throughout the semester has any questions, comments, and or concerns, please, I'm readily available. You can meet with me or we can go back and forth on email. But I really wanted to make this a beneficial class to everybody. It's a little different. We're teaching CBT totally online. There's a gigantic part of me that wishes this was blended, where we could actually do a lot of the knowledge base online and then the practical skills in class to actually learn how to not only learn about CBT, but apply it to our future clients, our current clients and patients. But that's not the case. So hopefully we're going to be able to do that through some of the competency videos and different aspects. I'm also going to be providing any time for people to come into the office and actually review some of the skills we're going to learn in here, and hopefully that can help. That's extra. I'm not asking everybody that. It's not mandatory, but if you want to do that, I'm open to it. So, as you can tell, I'm a gigantic Eagles fan in the back, which, by the way, we're Super Bowl world champions. Anybody who's not a non-Eagles fan out there. And also, that's a dollhouse up here, dollhouse on the second floor. I'm surrounded by Barbies, My Little Ponies, and JoJo Siwa. If anybody, Google JoJo Siwa Boomerang and listen to it 5 times, and then let me know how you feel after that. It hurts. All right, so in the syllabus, before we get started, I provided a lot of resources. Hopefully that can help you. Check them out. It may come in handy, especially if you're writing your paper or just want to gain more knowledge and skills into it. One of the things that I'm kind of bringing into here, hopefully, is right now I'm working as an assistant professor. This is my full-time job for Holy Family University, but I'm also a contract worker with the Beck Institute in part of their projects where I supervise people in Ohio, in soon-to-be California and Arizona and Michigan on their CBT skills. I actually listen to their audio tape sessions with clients. I evaluate them, and once they get to a certain number and they graduate from that part of the program, then I supervise them as they're teaching their supervisees. So I'm going to bring in some of that, especially I was talking to Judy and a couple other people from the Beck Institute, and so I'm trying to think of creative ways that really can help everybody in the class enhance their CBT skills. All right, so number one, all written assignments and the videos, please email me. Don't put them on Canvas. I really want you to email them to me. I find it right now that there's less formatting issues if it's emailed directly to me instead of me downloading it off Canvas. Right now, I can do that. It's not mandatory that it has to go on Canvas, but so please email me. The other thing is the due dates for all the information on here. I'm going to provide all the information. I'm going to put everything up, hopefully, on Canvas that you will need to actually enhance your skills. You do not have to wait till the due date to hand it in. You can get it in as soon as possible. If you're one of those people who wants to get things done immediately, then please feel free. I'm going to try to get some clarification videos and some demonstrations of the competency videos to you, just for you have an idea of what it looks like. But with the term paper, different things like that, if you feel like getting in, please. Let me see, what else am I? And that's all I wanted to hit on that part. Regarding the course requirements and assignments, we're going to have written assignments. We're going to have 4 competency videos. We're going to have a 10 to 12 page term paper. And I'm also, for the term paper, I'm going to post, I don't think it's the final edit of my term paper for the CBT class I did in the doctorate program, but I want to put that up there just for everybody has an idea of what it may look like, the formatting, how it could, and whatever kind of population that you choose on working with the CBT. Mine was I chose CBT and addiction, specifically alcohol abuse, and participation. Which participation is when I post something on the discussion board, whether it's a review, a question, a review of a paper, a video, talking about CBT and stuff like that. How would you use CBT with this population? That's how I'm judging participation, how frequently you're responding, how well the content's put together. And I think that is the main points I wanted to talk about with the participation. So for the written assignments, we're going to have 2 cognitive conceptualization diagrams, which is on page 5 of your packet of information. The one thing that I want you to kind of make a change on is one of the things that it was actually discussed with one of my group supervisions with Dr. Beck. The relevant childhood data, one of the points that I brought up was, like, sometimes when we're using these diagrams, which throughout my doctorate program, I went to PCOM, it was a strictly CBT program. We use these all the time. Can you put a slash where it says relevant childhood data and include and life events? So relevant childhood data and life events to incorporate into here. So I would like you to do 2 of these. The first one, along with like going through the cognitive distortions, the DTR, stuff like that, I would like you to do at least the first one on yourself. You don't have to, but I think that's a great way of learning. But I do want to say, like, you do not have to do this on yourself. You can pick a fictional character. You can pick somebody that you know, de-identified. You can pick someone, maybe you're working in the field right now, de-identified. You can use that, but I think it's a great way of learning. So 2 cognitive conceptualization diagrams. You're also going to be going through the cognitive distortions, which is this page. Which, by the way, this part at the bottom, challenging, I had to put that on for a patient at the hospital. It's like, yo, Dr. Mack, listen, you go over challenging these cognitive distortions with positive, adaptive, realistic. Can you just write it down for us? Like, come on, we got these bendy pens that don't work. So I put it down for him. One of the things that is interesting, and I'm going to have a video just explaining this. I'm going to give you an example of what it looks like. I'm also going to give you an example of how effective it was with, I'll give you one example. I give it in class sometimes of somebody whose wife died 4 months before coming into the hospital. He made a very serious attempt to kill himself. He tried to overdose on pills. He ended up in the emergency room and then came into the Brooklyn Behavioral Hospital. And this was really an impactful group for him, but also him doing it really helped out. And I'll give you an idea. I'll give you another example of when I was working in private practice, how it was really effective with somebody who was extremely resistant, very resistant. And there's many other examples I could give you of how, like, impactful these kind of things can be, but those are the 2 that I think will sum it up and give you a good idea of how you want to apply it to your own practice. So for this, though, for the 4 self-identified cognitive distortions, you're just going to pick one of these out that you have throughout the day. This is a very simple task. I just want to see if you can get it done. Feel free to be an overachiever. You can send me more than one, but on a Word document, which you're going to send to me, you're going to have the one. It could be this. Like, I'll give you a cognitive distortion, okay? Like, I'm going to fail this class because I don't know anything about CBT. That's it. So if you look at it, be like, all right, I'm going to fail. Like, what cognitive distortion is that? It's jumping to conclusions, fortune telling. And how do you challenge it? Positive, adaptive, realistic. Positive, you could actually, and positive, adaptive, realistic. Adaptive is really tough sometimes. And in the example that I give in another video, I hope it clarifies it for everybody. But a really quick way of challenging that thought and writing it down is, okay, you write down your negative thought. I'm going to fail this class. The positive, adaptive, realistic. Which, by the way, some of the people that I'm supervising on the Beck Institute, they incorporate it into their agency. Let's rap about it, realistic, adaptive, positive. And somebody else says, okay, let's break out the PARs, positive, adaptive, realistic, just to make it more fun for the clients. They're very happy about it. I thought it was pretty cool. But the positive thing is that I haven't failed a class yet. I'm going to study my butt off and pretty much do well. The adaptive thing is that, okay, I'm having this negative thought of failing and I'm doing something about it. I'm writing it down. That could be very adaptive. That I'm challenging my negative thoughts and I know that I need to explore this a little further. And realistically is, I don't know if I'm going to fail. I'm going to work hard, you know? Like, I'm going to do everything I can to make sure that I pass this class. And the realistic could be, again, maybe you haven't failed a class, or maybe you have failed a class before and you've learned from it. And you're going to take what you learned from that and bring it into this class. So all that does is it stops that negative thought from spiraling out of control. And in the video, when I describe it, you'll see how it can. And I love doing this group. I love talking about this in a group setting or in an individual setting, but especially in group, because when I'm giving the example, you can look around the room and like people are like, "Oh yeah, that's me. That happened. That has happened to me." I'll have so many times because especially if I'm doing a DNA group in there and I start talking about this and it leads to a relapse, I'll have somebody go, "Yo, Dr. Mack, that's me. That's my life story right there. That's exactly how it is." And so now you're giving them the tools how to fight that, how to challenge that thought. I just want you to do 4 of them, okay? Like, it could be that, you were, okay, like, I came home, I asked my wife how she's doing. Let's just say this is fake. And she gives me a look and says, I'm fine. And in my head, I was like, oh, she's mad at me. That's mind reading, jumping to conclusions. Where the truth is, maybe she has her mind on other things. Or maybe one of my kids, my 7 or 4-year-old, just gave her an extremely hard time, and I'm walking home in the middle of it, which happens often. But there's other kind of ways too. So I just want, and we're going to go through different examples, but hopefully that helps clear that up. It's very short, simple, and sweet. I just really want people to get that knowledge down, because you're going to need this in order to like move forward with the dysfunctional thought record, which are the next 2 assignments. You're going to need to do 2 DTRs. If you can, do 1 on yourself. If not, like I said, use a fictional character, use somebody that you know, use a client, de-identify all the information. But I just really, if you have any questions about it, please let me know. But I really want people to like kind of like get the cognitive errors down and then do the thought record. In the hospital setting, we don't do DTRs. They're too comprehensive. There's too much stuff to do, unless I'm doing like a one-on-one patient, depending on who that person is. A lot of times I just go through the cognitive errors and challenging it with the positive, adaptive, realistic. The other thing I bring into it, which I put up on Canvas, is the defense mechanisms, which is crucial. Like when a patient recognizes their cognitive errors and their defense mechanisms, they can accomplish a lot like outside of the therapy office in doing like their assignments, doing their homework, and trying to recognize, when they're making it, for it doesn't spiral out of control into a maladaptive behavior that may hurt them. Maybe it's drinking, maybe it's cutting, maybe it's anger, maybe it's isolation, those kind of things. Those are the kind of things that we're trying to help our patients with. Okay, then we get to the competency videos. So I'm going to ask for 4 videos, and just by doing this right now, I know how hard this is. So rest your anxiety aside, have fun with it. I'm the only one that's going to be saying it. Unlike you, everybody's seeing this, and hopefully this makes sense. I was going to make a joke and saying that the camera just added like 20 pounds to my face and my body, but that's not true. But I would like, and the reason why I'm asking for these competency videos is because the most important thing is when you leave here, and I say this all the time in class, I want you to know the information, but I also want you to know how to apply it. Because I've heard so many times in a group setting, in rehabs, and residential treatment facilities, even when I'm doing presentations, people come up to me and be like, "Yo, Dr. Matt, can I see you? And do you have a practice? Can I see you?" And I said, I don't. When I was working at the hospital, now I can't. I work here. And then they would talk about really sad, depressing stories about finding really bad times in treatment. And a lot of times it had to do with maybe they weren't ready. But a lot of stories I heard were some of the not very competent, unethical, unprofessional therapists that were out there. And that was one of the reasons that drove me to teach. So I really want people to get a lot from this class to be able to apply it directly to a client and patient to help them out. So the number one video is just use somebody, like a family member, like I said, it could be anybody, it could be a classmate that you know, and I just want you to explain CBT to them. Because there's going to be times that, like, and especially this is going to happen, where you're going to be asked what your theoretical orientation is. What is cognitive behavioral therapy? And not only do I want you to explain the rationale for it, what it is, but it would be interesting if, like, hopefully the person that you're using asks you a question like, hey, does that make sense? And says, well, you know what, I'm a little confused in this area. And then you can, like, clarify it for them. Because you will, without a doubt, you will be asked, what is CBT? Why is it so helpful? Why will it help me? Why is it different than other theories? You're going to need to know how to explain it, especially if you're being asked that in the first session and you do a poor job in explaining it. You already set the tone for a really tough session to rebound from. So that's number one. There's no time limit on it. Okay, I have a rubric and kind of like what I'm looking for in it, but I just really want a nice way of explaining what CBT is. Maybe you throw in an example, and if the person you're using has a question about it, even better. It does not have to be perfect. I know we're new here, but I want you to get comfortable in explaining what CBT is. Review, I do not want to give you an example of that. I want to hear what you bring to the table. Because I don't want you to like feel like you're boxed in with what I'm offering on this assignment. The other part is the cognitive errors. Now, this is a part that I'm going to put a video together for you just to explain it. You can adapt it and however you would like, but this is what I brought to the table. I'm going to show you how it is used in a group setting, how to explain it. And I do the same kind of thing in individual therapy, but I'm going to give you two tough clients. Who really benefited a lot from it. So I'm going to give you an idea for that. The other one is, and also for all these taped assignments, apologize to your loved ones and your friends who you're going to use for this. But I would like you to use somebody else in it to explain it to. The cognitive distortions, you're going to be explaining it to them and how they can challenge it with a realistic adaptive positive. With the DTR, I want you to review it with somebody and actually go through it. You're going to be setting up the setting event. You're going to have them rate it. You're going to be going through that entire process and also the questions at the bottom of the DTR. And the other one is, it's up to you. The fourth video that I'm asking you guys, it's whatever you want to. It can be from the packet. You can talk about, you can just demonstrate the Socratic questioning. There's a book out there. It's called The Feeling Good Handbook by David Burns. There's a lot of great information out there, a lot of other CBT skills that you could actually demonstrate and provide. I didn't want to, there's enough books in this class where I didn't really want to overwhelm you guys financially, but that's another book that I would actually say that would be good to get. All right, now that's good. Now we're going to go to the course paper. All right, so this is 10 to 12 pages. Title page, abstract. Like I said, I'm going to post my paper just to give you a little idea. I don't believe it's a finished product on it. I think I made a couple more changes in it. I can't find the finished product. I have a hard copy of it. I will tell you that, as many of you know, like I struggled with my APA at PCOM my first couple semesters. And I strengthened it. This is why I'm like kind of a big APA person, because I really want you to leave Holy Family, be prepared to write professionally. And if you decide to go for your doctorate, to be ready for it. PCOM, their doctoral program was amazing. Really prepared me really well for professional writing, APA, and the clinically like sound CBT skills. So I'm going to post that paper and give you a little. It should help you, I hope, a lot. And the other thing too is that's an A paper, so that's not bad. So I think that was my first. That might have been my first day after the first couple semesters there. So it's a lot of work. You really kind of have to bust your butt in your master's and doctoral programs. So I gave you an outline of what the therapy paper should look like. Mine was on CBT and substance abuse, alcoholism, and there's a session by session part of it, which I think is a good feature if you want to use that. Again, you're just you're pretty much like it was based on a true story. The guy I put in the paper, but you are putting together what your CBT therapy sessions would look like with this person. I gave you the rubric for the CBT outline, minimum of 10 references, 10 to 12. Also, if you are unsure about your APA writing, send me your paper and let me look at it. One student already sent me her paper. Honestly, I thought it was really well done, but there's certain APA things in there that you wouldn't get, like how to reference for the first time 6 authors in text. You don't put all the authors in there. It's the first author's name et al. How to like exactly like punctuate the title, like the author and et al. There's no comma after the person's name. It's person name et al. Period comma the date. The other thing too is, which is just like a pet peeve of mine now, make sure the entire document is double spaced, but be careful. Like you'll see like bigger spaces in certain sections, especially between paragraphs. Make sure the before and after are set at 0. The entire document should be double spaced, but the before and after at 0. Again, look at your APA manual if you have any questions. If you would like to send me like a general outline, I do this every once in a while, a general outline of what your paper looks like. I'm not going to check it for content if it's not ready, but of like all the APA, the heading and different things like that. Like, does the title page look good? If you can get that to me by June 1st, because it's due, I can do that for you and then you can send it back. But any way else I can help, that's fine with me. And I think that's all. If you have any questions, comments, concerns, please email me. We can set up a meeting again with the tape sessions. Oh, that's it. Thank you. I forgot this one. The tape sessions, please put it into YouTube and send me the YouTube link. In the counseling skills, we do a lot of tape sessions, and I've learned that some of the videos that I get, they don't open fast enough or there's errors. But if you put it in the YouTube, you create a YouTube account. I did it. If I can do it, anybody can do it. But I created a YouTube, and then you just send me the link to it. It's just, there's like no errors. I have no problems opening it up. And so that seemed to really work out the last semester I taught counseling skills. All right, other than that, I think I'm going to close this video down, and I'm going to put together the one video about the cognitive errors and send it out. So just don't think I wear a tie and the shirt like every day. Some of my videos I may be wearing my Eagles jersey. The other thing too I want to explain and apologize for. I have a 7- and 4-year-old, 2 little girls. They're very excited that I'm doing these videos because they want to be part of it. I told them that's not appropriate, it's professionally, but they basically said, no, Daddy, we're going to come down and we're going to be part of it. So they just might pop in and say hi. Thank God they get their looks from their mom, like amen, because 2 beautiful little girls. But other than that, I hope everybody has a great day. If you have any questions, please let me know, and I will talk to everybody hopefully very soon. All right, thank you.